Remember, KACOBA stands for Kagoma Community-Based Organization. The founder members, which they were 20, were basically in Kagoma County, which is found in Jinja district. So, over now, KACOBA and its activities have been admired and therefore working in over 13 districts. The most famous initiative that is admired and therefore welcomed by everybody is the HEN project. HEN stands for Health, Education, and Nutrition. So we have come up with a framework, just as you can see: health, education, and nutrition. This is defined in our terms as, HEN is an integrated community development approach to poverty reduction. An integrated community development approach. Integration meaning, as we are trying to implement the 8 Millennium Development Goals, we believe that it is possible for many activities to be carried out at one household. And as you will see later, with properly implemented HEN project, we can come up with a number of outcomes, including slowed progression to AIDS. Slow progression, actually it would be slowed progression of HIV to AIDS. What does it mean? When you get infected, doesn't mean you are sick. You can only get signs and symptoms when you do not feed well. So when we say somebody is healthy and is educated formally or informally and with good nutrition, you have increased production at household level. And when there is increased production at household level, it means increased and sustainable household incomes. You can refer to a home that has implemented the health, education, and nutrition strategy. There are fruits, nutritious foods, pawpaws, mangoes, oranges, even cash crops like maize, cassava, cotton. There are also other local and locally available and organically grown foods that can be at home. Indigenous rearing of chicken, piggery for non-Muslims, dairy, goats, and others. Each of you has seen a home where everything is there. So if there is increased production, that means increased and sustainable household income. And remember, women are custodians of economics at home. Therefore, when there is increased and sustainable household income, there is therefore women's empowerment economically, academically, and socially. It is also the other way around. When you empower a woman at home, economically, academically, and even social, then there is an increase and actually sustainable household income. But that comes out as a result of implementation of the health, education, and nutrition strategy. Now, when you empower a woman, as we said, economically, socially, and academically, then there is a reduced poverty. But before you come to that, when a woman is empowered, there is a reduced risk gap of HIV infection. When a woman has some money, she's able to take care of herself. She has a good enough education to know what is good and bad, and she knows how to negotiate sex and when to give birth and who to go with. And even socially, when somebody has some money and is academically well off, even the social capacity is increasing. That means there is reduced risk gap to HIV infection. But that's as a result of health, education, and nutrition strategy. But it has got a direct impact on reduced number of HIV/AIDS orphans. Because if nobody dies of HIV, then there is no orphan. And that has got a double indication and the result of reduced mortality due to HIV and AIDS. That's why we believe that implementation of the 8 Millennium Development Goals is the responsibility of everyone. It includes reducing poverty, as this framework gives us the end results. Reducing extreme poverty, reduced child mortality, reduced suffering due to the reproductive effects, or improved maternal health. We have got others like universal primary education, international cooperation, environmental protection, and others. As we conclude, the HEN project has been implemented as a pilot project in Jinja, where we have got clean compounds, reduced diseases, reduced frequency of visits to health centers. In Masaka, there's increased production of simple products like pumpkins. Other districts have joined like Nakaseke, Nakasongola, Mukono, PG. We know of Mayuge. Now Gulu has joined it, Mubende and others. So, HEN, which is an integrated community development approach to poverty reduction, if implemented by that approach, you therefore have an end result of poverty reduction.